Hello, everyone. This is Dr. M. Samananda Singh, currently working as an assistant professor in Institute of Pharmacy, Samananda University. Today, I'm going to present a topic on depression, stress, and anxiety. These three terms are one of the major health concerns which is related to mental health problems. So we need to understand this topic as a basic concepts of what are the difference and what are the different symptoms, what are the treatments of these particular terms. So mental health is an essential component of overall well-being, and yet billions of people worldwide experiences mental health challenges that affect their daily lives. Among the most common conditions are these three terms: depression, stress, and anxiety. But these terms are often used interchangeably, that they are distinct conditions with different causes, different symptoms, and different impacts. So in this presentations, I will be discuss about what are the depressions, stress, and anxieties, and their symptoms, and what are the risk factors, and what are the strategies which is available for the prevention, management, and the treatment. So moving to introductions part, the mental health is one of the important for our emotional, psychological, and social well-being, and it influences how we think and how we feel and how it acts in our day-to-day lives. So this topic, depression, stress, and anxiety, are among the most common mental health concerns worldwide, and these conditions can affect people of all ages and backgrounds. And with these disorders, it can influence the relationship among each other, and the performance of our work performance, academic achievements, and overall quality of life. That it can be influenced. So, however, the good news is that with the proper awareness, early intervention, and appropriate treatment, this condition can be effectively managed. So, by definition, in this slide, what is depression? Let us know some idea. What is the basic concept of what is depression? Depression is a mood disorder which is characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities that were once enjoyable. And unlike normal sadness, depression lasts for weeks or months and significantly affects daily functionings. So, with this problem, people with depression may experience changes in sleeping patterns. It will affect to appetite, energy levels, and moreover in the concentration. So, depression can impact emotional, physical, and social well-being, and if left untreated, it may seriously reduce a person's quality of life. So next is what is the symptoms of depressions? What are symptoms? From which symptoms we can identify that the problem is for the depressions. The symptoms of depressions may vary from one person's to another person's, and the common symptoms include persistent sadness or feelings of hopelessness, and loss of interest in activities, and another one is fatigue or low energy. These are one of the very common symptoms of the depression. So these symptoms with individuals may also experience sleep disturbances, difficulty concentration, and feelings of worthlessness or guilt. This is also one of the major symptoms of the depressions. And many people that begin to withdraw from social interactions, and he always feels that he just want to isolate from others by themselves, from friends and family circles. These are the common symptoms of the depression. So recognizing these symptoms as early as possible, it is important that because timely intervention can greatly improve the outcomes of these common disorders. So the next topic, we need to understand that what is the stress. Stress is very much common nowadays. So people say like because of stress is not able to work properly. These are the common terms that everyone faces. But from depression to stress, it's a little bit different. The term meaning is little different. And the stress is the body's natural response to pressures or challenges. In moderate amounts, stress can be helpful because it motivates us to meet deadlines, solve problems, or adapt to the new situation. But, however, when stress becomes prolonged or excessive, it can negatively impact to physical or mental health conditions. So long time stress can contribute to headaches, blood pressure rises, weakened immunity, sleep disturbances, and emotional exhaustions. This can impact to this prolonged stress can impact to this type of problems. So therefore, learning healthy ways to manage stress is essential for maintaining overall well-being. So next is what is the common causes and symptoms of the stress. There are many causes of stress in everyday life. The common causes include academic pressures, heavy workloads, financial difficulties, relationship conflicts, and major life changes. So these are some common causes of how the stresses occur in our mind. So stress can often present with symptoms such as headache, muscle tensions, irritability, fatigue, and sleep problems. These are also one of the symptoms from which, from stress, it may occur. So some people may also experience difficulty concentration or changes in eating habits. These are the common experiences which a person normally face because of the stress. While occasional stress is normal, persistent stress can interfere with daily functioning and increase the risk of developing other mental health conditions as well. So, the next term is what is anxiety. Anxiety is also a little bit differ from depression, stress, and stress. Okay, so anxiety is characterized by excessive fear, worry, or nervousness about future events or uncertain situations. So, everyone experiences anxiety occasionally, especially before important events such as examinations or interviews. So, however, anxiety becomes a concern when it is intense, persistent, and disproportionate to the actual situations. So, it may occur independently or alongside other conditions such as depression and chronic stresses. And when anxiety begins to interfere with daily activities, professional support it is very much required. So next, what are the common symptoms of anxiety? Anxiety can affect both mind and the body. Also, what are the common symptoms that can influence the normal life? So, what are the common symptoms in the sense? The common symptoms that include nervousness, restlessness, excessive worrying, and constant feeling of being on edge. These are one of the common symptoms of the anxiety. Physical symptoms may include rapid heartbeat, sweating, trembling, dizziness, and shortness of the breath. These are the common symptoms of the anxiety, and some individuals experience panic attacks, which involve sudden episodes of intense fear accompanied with physical symptoms. These symptoms can significantly impact daily functioning if not properly managed. So, let us know that what are the common differences between this depression and stress anxiety. Although depression, stress, and anxiety are related, they are distinct conditions. Depression is primarily characterized by persistent sadness, hopelessness, and loss of interest in activities. While the stress is generally a response to external pressures or challenges and may be temporary. And on the other hand, this anxiety is mainly associated with excessive fear, worry about future events. So, depression often leads to low mood and reduced motivation. Stress results from demands exceeding coping abilities, and anxiety involves ongoing apprehension and nervousness. So, to understand these differences is very much important because these conditions may require different management approaches. So, next, what is the risk factors of these conditions? Several risk factors that can increase the risk of developing depression, stress, or anxiety. So, among that, genetic predisposition, traumatic experiences, emotional abuse, major life challenges, and chronic illnesses. These are one of the major risk factors which can enhance the disorder, I mean, these conditions. The substance abuse and a lack of social support can also contribute to mental health problems. So we need to understand what are the major causes of this particular disorders in order to prevent from these conditions. Additionally, ongoing academic, professional, or financial pressures may increase the vulnerability of these conditions. So, identifying these risk factors allows healthcare professionals and individuals to take preventive measures and seek support early as possible. So now the next part is how we can manage and do the treatment of these conditions. So there are several effective approaches for managing and treating mental health conditions. Psychotherapy, particularly cognitive behavioral therapy, helps individuals identify and modify negative thought patterns. Healthy lifestyles practices such as regular exercise, adequate sleep, balanced nutrition, and relaxation techniques can enhance the mental well-being. And also, sorry, also with the certain supports from family and friends and community groups, also this if they take a certain roles to support the particular uh, patients is also very much important as a preventive roles. And in some cases, medication prescribed by the healthcare professionals may be necessary in the extreme conditions. And a combination of the therapy, lifestyle changes, and professional support often provides the best outcomes. Often provides the best outcomes. Yes. So next is how we can prevent these conditions. Prevention is better than cure. That term is very much required to understand. So preventing mental health problems involves adopting healthy habits and maintaining emotional resilience. So regular practice of physical activity, balanced nutrition, and sufficient sleep. Sleep. We need to maintain sufficient sleep, and with this, it will contribute to better mental health. And practicing relaxation techniques such as meditation, mindfulness, and deep breathing can also reduce the stress and anxiety. So, along with that, maintaining strong social connections and seeking help when needed are also important preventive measures. Early recognitions of these symptoms and timely intervention can prevent conditions from becoming more severe. So, these are the common prevention techniques that we can take up uh, for these conditions. And in conclusions, this depression, stress, and anxiety are one of the major challenges nowadays in this present scenario worldwide, and although may differ in their causes, symptoms, all their conditions can significantly impact quality of life if left untreated. So, awareness, early detections, identifications, healthy lifestyle practices, and access to appropriate treatment are essential for effective management. So, with this, we can promote the mental health education, reducing stigma. We can encourage individuals to seek help, support when it is needed. It is very much required. So, with this, I would like to wind up my talk, and other uh, in-depth uh, ideas about this topic, I'll be explaining the coming time, coming talks. Thank you so much.